Hi all, thank you so much for watching this video. Today we will discuss about the common signs and symptoms which is presented during the cardiovascular problems, and we will try to check some of the diagnostic tool which help to find out the heart diseases. We know that in a hospital or a clinic sometimes the patient will come himself and he will be oriented and alert. Sometimes he will be brought by an ambulance or by the patient relatives. If he is alert and oriented, the most probably or the most common symptom is angina. Angina is explained as the chest pain or chest discomfort. The characteristics of angina or chest pain can be varied by person to person. It can be explained as a squeezing or burning or throbbing pain in the chest, that means behind the breastbone. And the second one is dyspnea or any kind of breathing difficulties. And third one is palpitation, that means increased sensation or increased heart rate. When the patient complains of palpitation, we have to ask the person the nature and the duration of the palpitation. And some other symptoms are lightheadedness, syncope can be happened. And arrhythmia is also one of the signs and symptoms which can be included. All these signs and symptoms can be appeared, but sometimes it is not seen in every cases. So what happens if the patient brought in an ambulance and he is not conscious and alert? So practically we can think he won't be able to inform anything what he is going through. But during that time it is very vital to understand what is happening in his heart. So the first test which we have to do is ECG, electrocardiogram. Based on the ECG evaluation, the doctors can assess what is happening even though the patient cannot speak. And the next one is asking the history to the patient relatives or those who came with the patient. So regarding this question, it can be used even with the patient who is alert and oriented. For an easy remembering, we can use the word sample. So the S stands for signs and symptoms. A stands for allergies. And M stands for medication which the patient is currently taking. P stands for past medical history. And L stands for last meal. E stands for even before the occurrence. So this history can help us to identify a reason or a cause for this current situation. Next we will speak about the diagnostic evaluation which is needed during a cardiovascular assessment. The first one is ECG, which is called electrocardiogram. It is a graphical representation of the heart activities. So this can be considered as a test which can do during an emergency or at a normal evaluation. The next one is some blood test. The blood test starts with CBC, that is complete blood count, which shows the normal infection level and differential counts and platelets, followed by electrolytes, which include sodium, potassium and chloride. Then comes lipid profile. Lipid profile is a complete evaluation of the cholesterol levels, which includes good and bad cholesterol and triglyceride. When the cholesterol is high, it is called hyperlipidemia, which is one of the risk factors for the cardiac diseases. If the patient comes with a chest pain, immediate test like troponin I, CK, CKMB is considered as a priority because these markers will go high when there is a cardiac muscular damage happens. And If the patient is complaining of palpitation, we can consider the blood test called TSH, which is thyroid stimulating hormone. The next step of test is called echocardiogram. This test can help to diagnose heart condition. It uses sound waves to create pictures of the heart. This common test can show blood flow through the heart and heart valves. And it can use the pictures from the test to find heart disease and other heart conditions. Then followed by treadmill test, where the patient is made to run in a treadmill to evaluate the heart functions. It is followed by angiogram. It used to check the health of the blood vessels and how blood flows through them. It can help to diagnose or investigate several problems affecting blood vessels, including atherosclerosis, that means narrowing of the arteries, which could meant you are at the risk of having a stroke or heart attack. The next is CT scan and MRI. CT means computed tomography, which is used to look inside the heart to fully evaluate the heart muscle, pulmonary veins, coronary arteries, thoracic and abdominal aorta and more. This test also can be performed using a MRI, that is magnetic resonance imaging. It is a non-radiated or radiation based study that used high power magnets to see inside the body.